Hi, good evening, everybody. This is Dr. Shalini Sharma, the founder director of Global Institute for Circular Economy and Sustainable Development Goals, the NGO based at Hyderabad, the southern part of India. The organization mainly working on circular economy, climate change, digital circular economy models, and digital standards. Through the journey of last 3 years, we have been working on various national and international projects, especially on the subjects, the core areas which I just mentioned. Today, I welcome you all this evening on the Friday of 3rd December on a webinar on climate change, especially the decisions that have been taken in November in COP26, that is Glasgow Climate Pact. We have gathered here to see that there is a lot done around during the discussions, the intense discussions between the countries, but still the leaders, top leaders, climate leaders, and many climate enthusiasts, they say that there is a lot to be yet done. We have just gathered here with the speakers, Ms. Swayam Prabha Das and Dr. Nitish Chopra, to talk about that what more can be done, what could have been done better. So there are a lot of things. I'll just take very briefly your attention on what exactly we are going to talk about, and then we will introduce our speaker, and then the webinar will flow. So during COP26, we have heard about that ambitions need to be increased. We are going to talk about what could have been done better about it. If we say national adaptation plans, there was lot of talk about that need to be strengthened. It need to go stronger. Then there are another things about the international collaboration. Are the centralized efforts of climate change, adaptation and mitigation in the vast countries and country like India are going to work? So these are some of the topics that need to be discussed. Then there is another topic, managing the conflict. Climate change is giving rise to various conflicts. It is about area, it is about food, it is about land, it is about the green technology. Then there is another issue. We have seen that the coal power plants, they are charging the solar power industry. So where is what happening? Really, these are the glaring issues that need to be looked into. How the local policies need to be working in alignment with the international policies like Glasgow Climate Pact. What should have happened after the Glasgow Climate Pact is formed, and how it should be percolating down to the national and local and regional policies, how the actions can be taken on the ground. So these are few issues and a few points, like phasing out the fuel, phasing out the fossil fuel is one of the issues. So there are various things that we are going to talk about in this webinar today. And for that purpose, we are having our expert with us here today. And let's go on the webinar. Mr. Vakut, kindly introduce the organizations and our esteemed speakers.
Absolutely. I'd like to introduce our organization, Global Institute for Circular Economy and Sustainable Development Goals, who is hosting this webinar. We are an international think tank headquartered in Hyderabad, India, and we have associates in Brussels, the EU, and South America. We at the Global Institute for Circular Economy and Sustainable Development Goals strive to educate and facilitate the transition from a linear to a circular economy. Our aim is the advancement of science and technology through new age research and development, while also innovating and spurring innovation to foster good governance and support businesses for the social good. We serve for the design and development of digital circular economy models and systems. We guide and handhold businesses to turn zero waste and provide zero waste certification, implement capacity building programs and awareness campaigns, and provide advisory services. Also, we have recently launched an international alliance on circular economy and SDGs. We have founder members and mentors from Niti Aayog, Government of India, Tata Chemicals, Government of Telangana, Government of UP, VCOT, Basketball Brussels, EEB Europe, and Hindalco, and more. With that, I'd like to introduce our speakers for the day. Dr. Nitish, we know that you need to leave by 5:25, so I'm going to do introductions earlier so we can speed up the process a little bit. Our first speaker for the day will be Dr. Swayam Prabha Das. With over 24 years of progressive work in the field of program development and management, policy formulation and advocacy, communication, and community engagement, Dr. Das's scope of work spans across sustainable development goals, human development, skill development, environment and climate change, wildlife conservation, and social sector development. Dr. Das received her doctorate in the field of international relations in 2003 from Jawaharlal Nehru University, New Delhi, specializing in marine affairs. Dr. Das is a Hubert Humphrey Fellow from the University of California, Davis, where she focused on natural resources management, marine ecosystems, and designation of marine protected areas, oceanography, conflict resolution, and project management. Our second speaker is Dr. Nitish Dogra. Dr. Nitish has done his MBBS and MD from the University of Delhi. He has also received a Master's of Public Health degree from the world-renowned Johns Hopkins University in the United States. Subsequently, he has worked in several coveted institutions, including JHU, INCLEN, and TERI. He has earlier served as assistant professor at IIHMR Delhi from 2009 to 2014. In addition, he was selected for a Fulbright Nehru Environmental Leadership Program Fellowship for 2013 to 2014 by the United States Department of State and Government of India. During this period, he was based at JHU as visiting faculty. He also convened the Understanding Climate and Health Association in India, training workshops in 2015. And with that, I'd like to hand over the floor to Dr. Swamprabha Das for her session.
Good evening, and thank you so much for having me here on this platform. And as you've already seen, that my interest lies more with the marine ecosystems, with the oceans. So I thought, why not just talk to you all about today about the SDG 14, which is the life below water, and how it is webbed into the COP 26 discussions, and what emerged and what more could have been done. So as you know, a healthy ocean is a key for a sustainable future of the people and the planet. It is also a huge carbon sink, and it also regulates our weather systems. So with that, if you look at it in the economic terms, the annual value of the produced goods and services from the oceans is also very high, and it is estimated to be at USD 2.5 trillion per year. So it's not just the weather, but it is also the economic value from the oceans that makes it very important for our sustenance and livelihoods as well. However, the ocean health is under threat, and there's pollution, there's nature loss, there's climate change, overexploitation. So all put together, we have actually taxed how we are using our oceans. The shipping and all the noise pollution from the submarines are also a great impact on our ecosystems and on our food chains and all the living organisms that we have in the oceans. So it is actually a hotspot for biodiversity loss, for economic gains, and also how the whole food chain and food web is also intervened. And I say this very proudly as a member of two of the IUCN commissions. One is on the ecosystem management, and other is on the environment, economic, and social policy. So I sit on both of these commissions, so I say it from that aspect as well. So what the conversation has really picked up is essentially on how do you make this ocean ecosystem a more viable and a more sustainable one. And many of you would have heard about the sustainable blue economy. And that is more like utilization of our resources to the best possible, not driving it to the planetary boundaries that we have already crossed with our exploitations, but how can we restore the ecosystems and how can we help it revive and get back? So this is the year 2021 to 30 is also the decade of the ocean science. And it was very pleasant to see that COP26 actually focused a lot on oceans this time than previous. So this year, it actually took them 6 years of effort that began with COP21 in Paris to have anchor permanently the oceans in the multilateral change regime. So earlier it was like not given that importance, but because it's the largest carbon sink, and that is actually now getting on to the policymakers, it's reaching the policymakers, it's reaching the NGOs, the expert groups, the civil society, youth, and also to the governments, and now it's being taken cognizance of. In its preamble, the Glasgow Climate Pact actually adopted a few parameters or few principles, which actually reflects on the oceans. And that says that the importance of ensuring the integrity of all ecosystems, including in forests, the oceans, and the cryosphere, and the protection of the biodiversity. So that is what the preamble says. And then in paragraph, and further, it welcomes the informal summary report of the COP25, which mandates oceans and climate dialogues to be considered how to strengthen adaptation and mitigation actions. So it is slowly and steadily, it is forming a part of that. And it will be very important to see how ocean is integrated into the work plan of the Sharm el-Sheikh work plan, and how in the next COP it assumes greater significance as well. This year, it was almost like 20 plus discussions that happened around oceans at the COP26. There was an ocean pavilion, which was very interesting, and it was also virtual. So I could also participate and see quite a few of the work happening out there. A lot of discussions happened on financing for oceans, and the Ocean Risk and Resilience, the Alliance, actually leveraged a lot of private sector funding. And it also had the blessings of many international governments and also organizations being a part of it. So probably ocean financing is now coming up big time. Blue economy is also assuming greater importance. There are lots of events happening with the economists taking charge of summits, ocean summits happening before and after the COP. IUCN, UNEP, UNEP also has a financing facility there for the oceans. So all of them assumed a lot of significant, they kind of, if I may say so, they led to a lot of discussions with the UN, with UNDP also leading a lot of discussions out there. So there needs to be, what was actually felt was that going forward, there needs to be a breakdown of the silos across processes and practices, basically, and better understanding of the oceans, the interaction with the climate, the biodiversity, and there has to be an understanding that it's inseparable. So you cannot deal with oceans separately. You cannot just talk about one part of it, but in continuation. Then the emphasis that the ocean provides multiple untapped and powerful opportunities to mitigate and adapt to climate change needs to be also emphasized on. The tools are available, but there needs to be more multiple benefits that is generated, and how do the people, the coastal communities, benefit out of it? What are the collaborative action that is needed across the countries? And there was a huge, how should I say, there was a very powerful coalition of the SIDS, the small island developing states, that could be seen there on the oceans, because their existence is very dependent on the sea level rise and climate change impacting their very existence. So the SIDS came up actually as a very strong lobby when you come to discuss oceans, and rightfully so. And so they asked for a more stringent and for a more determined countries to put in their NDCs and to cut down on their carbon emissions. So it was very strongly coming from that group. And therefore, there were times when they felt very happy about some of the wins, and then they were also saddened by how the COP deliberations kind of mellowed down on few things. But nonetheless, they are also asking for the financing from the developed countries to be channeled through the Green Climate Fund or to other financing mechanisms to these SIDS, so that they're able to adapt well to this climate change, while calling upon the developed and other countries to cut down their emissions, so that the temperature rise and the carbon in the atmosphere can all be limited, and we do not go beyond 1.5, which will be very tragic for many of these small island nations, including our very own neighbor Maldives. So keeping that in mind, one of the recommendations that also came up was how could the resources be mobilized from the private and the public and the private sector for investment in coastal and marine ecosystems, particularly promoting the nature-based solutions to mitigate risk and accelerate resilience and adaptation. both mitigation and adaptation, they say, required an increased cooperation, collaboration from all parties and non-party stakeholders. So this also brought together many voices onto the climate action table and processing an inclusive, and they call for an inclusive multilateralism. So this is what actually got all the countries together, is how do you accelerate, how do you bring in more funding, and how do you accelerate both? You look at both adaptation and mitigation together and not separately. And the roadmap needs to work on the oceans in a very more stringent and a more collaborative and a cooperative manner. So in order to keep 1.5 degrees within reach, we really need a healthy ocean. And it is the natural carbon sink, as I've said, that already absorbed 1/3 of the total anthropogenic carbon emissions since 1980s. And by ensuring human activities which directly impact and depend on the oceans are sustainable, we can rebuild the ocean prosperity and restore the biodiversity. Activities such as shipping, fishing, coastal tourism, port, marine renewable energy, and more, we need to transition towards a sustainable blue economy, which remains exceptionally underfunded. And with that, I would also say that India did come out with a blue economy policy, which is huge. Trust me, I've read it. They tried covering everything, anything and everything. We have also started looking at ocean seafloor mining. And I wonder how far and how much we can drive science to the limits where we are also kind of not destroying what's there, how we protect our ocean ecosystems, and how we are able to address climate change so that our communities are resilient, they do not lose their livelihoods. And we as researchers, as policymakers, how best we can support them with robust policies that's driven by evidences, by technologies, by innovations, and least of all, but most important at the last, but most important is women. We should not forget the women, and we should not forget to be inclusive in our approach to climate change. And that is very important. So building on traditional knowledge and our capacity of inclusivity, and the UN tagline that goes as leaving no one behind probably is the best way forward. So I'll end with that and look forward to a discussion. Thank you.
Thank you, Dr. Das, for your very thought-provoking session. I'd like to hand over the floor to Dr. Nitish right away, and then we can have a discussion after that. I think that would be great.
Thank you, Vaikunth. It's a pleasure to be here amongst our distinguished panel comprising of the Fulbright Fellows and a great team. Well, it's actually first of all, it's very difficult to speak after Swam Prabha, so it's not fair. But anyhow, I'll come here to our health sector, which, so I'm obviously very passionate about where we are as a sector in the larger climate world. And I have been personally involved in, guiding, being involved as a temporary advisor to WHO for the Paris negotiations and the one earlier. Now, of course, the pandemic is playing havoc with our schedules and our responsibilities. But from the little I could follow regarding Glasgow, yes, definitely our health sector was more prominent, but definitely at the same time, it was nowhere near the place where it should be. Because I think what we fundamentally miss out in all these climate meetings, and of course, to an extent, our own fraternity is partly responsible, that we are not able to highlight the fact that, climate change as it occurs, if it were only affecting polar bears and the bees and the plants and all, so it would still be a tragedy. It will still be unfortunate, I would say, but the tragedy, so to say, comes when it affects our daily life. Right now we are here in Delhi, and climate change is all around us. Whether it's the mess that we've created with the air quality issue. I like to highlight air quality because the day the climate pact was reached, the one image that was flashed all over social media was that here is this historic climate pact the world over, where everybody in the world is getting together. And then why are we doing this? Well, one reason is that here in the capital of one of the most important nations in the world, the children in that same capital are not able to go to school because of something which is linked to climate change. So I think the fact that, with successive COPs, the whole health dimension is having a more prominent role is itself something which is heartening. The other aspect, it is not too much that has happened in that space that I can even mention, but one new dimension which is very important, especially with no agreement on coal, is that the health sector, that's also not realized, that itself has a carbon footprint which can be reduced. So interestingly, in the US, the health sector carbon footprint is close to 10% if you include all health related facilities. We don't have exact data for India, but at the same time, now that we have a national program for climate change and human health, we are actually getting in this particular dimension that has been highlighted in Glasgow into our program, the one on climate resilient and low carbon health systems. So that is something we are now working on. It's going right down to our in our program, in our national program, right down to our primary health centers, from our community health centers to primary health centers, and of course at the district hospital level. So all our, it will go down. It is already, I would say, it's there in the documents, and it's going live all over the country regarding, basic steps like putting in solar panels, having water recycling, taking care about supply chain issues, ensuring, you have more local products. So all of that is very much ingrained because unfortunately we work so much in silos that we don't even know, amongst each other what we are doing. So luckily we now have enough experts. We have that NIDUS, we have that capacity built up, where we have people working on precisely the sort of recommendations that are coming out from these sort of high level meetings. So that's the positive part, right? So that's one aspect. So the whole shift on mitigation, our discussions on energy, transport, all of that is so important. It's all related in the sense that, because like we have all these mass transit systems like the metro, we actually did a study and we found that even the use of the metro actually reduces your air quality. It's beneficial as far as air quality is concerned, and also for physical activity. So these are the sort of dimensions of climate which are now coming in the co-benefits aspect, that you do activities, you modify your energy systems, and that itself can have health benefits. So that was something which was not an emphasis. A lot of the emphasis was totally on adaptation. That is changing, and that's something very positive that's going on. But at the same time, our fundamental approach in the health sector is as per what the WHO has built, which is on 6 building blocks, what we call, which is on the workforce, health information systems, medical products and technologies, service delivery, finance, and leadership. So all our adaptation response is essentially around those factors. And there are 10 different factors. Obviously, I won't go into all of them, but there are some critical aspects that I would like to highlight in the little time that I have here. One of them is early warning systems. So early warning systems are actually so important, and it's not just, I mean, we talk about early warning systems for Omicron or whatever, but that's exactly what is needed for our floods, for vector-borne diseases, for so many other aspects where we are just, not working on it to the extent that we should. The advantage that climate gives is that if you can actually work with climate scientists, you have an advanced warning, and you get a lead time of 3 to 4 months, for say something that's related to rain, for example, floods or whatever, and you can really prevent suffering, even deaths, and things like dengue and chikungunya, malaria, of course. So all our vector-borne diseases, diarrheal diseases, all of these are the traditional infectious diseases which are affected by climate. And of course, we have the disaster issue, right? So here, the one problem is that disaster and what we understand by how climate is affecting health is sometimes viewed very, very in a very diametrically opposite manner, and which is not the correct approach. So you could see it, for example, in let's say just in small aspects which are so integral that when we talk about triage. So triage is how you manage, let's say you have a small village and somewhere in Bihar, and there's huge floods, and you don't have enough time. Do you have enough volunteers trained? Do you have enough people who know first aid, and even something as basic? We heard Som Prabha talking about gender. So we have, for example, the issue that why is it that so many women end up dying in floods, and that's the higher mortality as compared to men, and there are many reasons for something like that. But one of the reasons is that women and girls are less likely to know swimming. That's a proven fact. So just something as simple as teaching girls to swim, of course, all of that has complex the situational issues attached, but teaching girls for as a life skill, that itself is a climate adaptation. So I think we have all these very macro, very sort of recommendations that come out from these meetings, but I think there's a huge disconnect between what is it on the ground that can be done and should be done, right? So here's my last part that I think since I believe, although I know it's a global audience, but since we are here in India, so what I can definitely say is that we have now the National Program for Climate Change and Human Health in place in India. We have as many as 16 centers of excellence which guide this, which include our institute, which is a center of excellence for vulnerability assessment, along with TERI. And what we really feel we are, we can manage to change things is by, communicating that, risk is there everywhere. But if you can categorize risk, if you can map risk, then you can direct your efforts much more effectively. The Pareto principle that if you have 10 districts and you have the top 2 or 3 correctly identified, then you are more or less done as far as your efforts are concerned. You cannot and you should not try and address the whole problem everywhere. That's one of the reasons, for example, the air pollution problem is not getting solved. So that's basically my take on all of this. I just discussed with the WHO focal point before we got onto this program that this session is coming up. I'm going to be talking in very generic terms to the climate and environment colleagues, who about what Glasgow means to us. But frankly, I mean, we in India, because of the situation, we did have as part of the Glasgow Climate Pact, on the sidelines, we had a global conference on health and climate, but because of all the flight restrictions, etc., we have had very little, participation from the South. So I think I don't know how it's going to pan out in other places, but definitely we are going to look through very closely at the recommendations, particularly on the climate resilient and low carbon health systems, and we're going to have a discussion. So this talk has inspired us to have our own sectoral discussion, and we will definitely let Dr. Shalini know about it, and through her you will know, you would be most welcome to join that panel and have a more meaningful insight as to the way forward for the health sector, both nationally and internationally. So thanks. That's it from my side. I might have to drop off, but I'm around for another 15 minutes. Dr. Shalini Sharma.
Dr. Dogra, I think we will be very quick on this. We have just probably 1 or 2 questions we will take here. So as you were already speaking for last 10-15 minutes, so I'll give you a break for around 2 minutes. I'll go to Ms. Swayam Prabha about this question. So Swayam Prabha, you have seen this new initiative that had come up, especially taking ocean into consideration and then taking actions around to protect the ocean, as it is the largest sink in the world, carbon sink. So taking that into center stage, I would like to ask you that what are the 5 or 6 or 7 action points that you think that India should be taking to work in this direction?
I think first and foremost, we need to start integrating, science and policy. And I feel that's a big gap that we have. Mm-hmm. And when we talk about that technology, we talk about, say, the environment. They are coming closer, but they need to move faster. They need to come closer, connect more well, better. And why I say this is because we have a huge 2 ministries. One is essentially on earth sciences that looks at the oceans, the ocean technology, the how should I say, the inquires, the management systems and all. And then we have the Ministry of Environment Forest, which is more coastal. But we seldom understand and most often forget the interface between the coast and the oceans. And that I feel needs to be integrated and brought together. And the blue economy policy that was draft that was put up, I felt that that's trying to bring it together, but there's still a huge gap. So that's one thing. Second thing is the space to bring in other stakeholders. For instance, how do you bring in, say, NGOs, the youth groups, the women organizations? So how do you bring the fisher folk organizations into the fold of discussions? So I feel that needs to be strengthened. It's happening in fragments, so it needs to all come together. And how do you develop a platform of knowledge sharing, knowledge exchange, which is on diverse topics? So that was my third point. The fourth and very critical is bringing together our financing, our finances, our funds. We are still somewhere kind of grappling with it. In India, we have not yet very much cracked on the private sector funding, if I may say so. We are either dependent on donors or on the government. So how do you bring in money from the corporates, from the not from the CSRs, because those are the foundations, but going beyond to the business, who are also exploiting our natural resources? So how do you bring them on board? How do you drive this whole environment, climate change concept into the sustainability mapping, into their work plans? So it's not just about money, but it's also about changing how the whole business operates. So it's the entire value chain. That needs to be looked into. Then you need to look at the green economy, the green livelihood sector, which is very critical and a key when it comes to the communities. And how can you work with, say, skill development, the sector skill councils, and how do you bridge that gap between skilling? Because post-pandemic, the way we are, work is not normal. So we need to skill, reskill, upskill, and how do you bring in those skills into sectors like renewable energy? Oceans technology, oceans energy is coming up big time, but how do you train people? How do you bring them into the fold, and how do you generate employment? So that's a key way of looking at how you can bridge the employment and the GDP, the economy kind of a thing. And how do you also promote conservation of your biodiversity and of your environment while you're doing so? So then you come again to the whole concept of an integrated, a collaborative, a cooperative process. It's not about you and me snatching from each other, but it's how we coming together and building it together, and how you are contributing, how I'm contributing. So when I look at Nitish, I would say that the medicines that's coming out of the oceans has a great benefit to the community, to the people. So how are we doing that? What is the, the premise of benefit sharing, with the communities? So all of these needs to be looked at. And when we are talking about the three major conventions, which is the climate change, the land, the UNCCD, and you're talking about the CBD. So they're all interlinked. And at the global level, they're trying to come together and talk it out and work it out together. So there are work plans where all the three major conventions are talking to each other and coming together. And that is what is also needed at the national level and local level. And unfortunately for us, if I may say so, are we looking at plantations? Are we looking at how do we green our corridors? How do we, build up those blue walls that protect us? So where are our mangroves? We talk about hurricanes. There are going to be lots and lots of changes that's coming in. So where are our green barriers, blue barriers? Where are we talking about protecting ourselves from these climate events? Are we even prepared? It's not about having cyclone shelters or reducing the number of casualties, but what are the natural barriers? How can we build them up? And they were there traditionally. It's our greed that we cut them down or we pulled it down, but we need to have them back up. It's our survival. So I think I'll stop at that.
Thank you, Swayamprabha. Thank you so much. I think there's a lot to do. And yeah, this needs to be geared up really at all angles, from experts' point of view, from society point of view, from the action point of view, and various things need to be done for sure. So coming to Dr. Dogra, you said that there is like about 10% of GHG emissions happening from the medical sector, and we understand, I think there are a lot of sectors that need to be considered, especially when we see medical sector. There are the SMEs, those use natural resources unaccounted, emissions happening unaccounted. So these sectors need to be taken into consideration. My question to you would be that what do you think that 3 or 4 primary actions should be taken by India to reduce the GHG emissions from the medical sector as such?
Yeah, so thank you for the question. Definitely, you see, one aspect is, what are the changes that you would be able to do in any building, so only difference being that when you are dealing with a hospital, you have certain parameters of air quality and microbiological contamination. Your OTs have some specific criteria, but besides that, basically it's essentially a green building at the end of the day, right? So many of the areas in any building, any hospital are quite similar to what would be in any other place. So all of those measures definitely need to be introduced. What would you do in any other green building? So you see, a lot of those changes need to be done for the facilities that are already existing. But more than that, as the new hospitals come up, they need to have it from day one. So now the thing is that, when the hospitals are being built, they already are adopting, so all the aims, for example, all the new aims, and they're all on this, they have adopted the climate friendly hospital, climate friendly systems, right? So they have it, all the major hospitals in the city, in India, the main hospital chains, Fortis, Apollo, all of them would have all of that in place. But as I said, not only having that in select private hospitals, in tertiary hospital like AIIMS, we now have it, into the health system. So now the moment these modifications now are there in our, documents, which are for the, our district hospitals, community health centers, we have 700 districts, and each district would have at least about 4 or 5 community health centers. So now the guidelines are already there, so it means 700 into 5, already close to 4,000, structures are already having this in place, right? So this is as far as what the health sector is doing here. But I think, it would be difficult to put it into 4 points like you're mentioning, but I think the one point is the structural changes that are there in any other sector, except that there are some minor aspects which need to be considered, for a hospital. So all that is happening now. So that's a very positive thing, and that it is happening in government, right, down the line. So I think the fact that we have a national program for climate change and human health, and one of those centers, mind you, that's the interesting part. We have 16 centers, as I told you, each center looking at different health outcomes, and our center on vulnerability assessment. One particular center just deals in climate friendly hospitals, climate friendly health facilities. It is a health institution, but they are working with Healthcare Without Harm. It's a global body. They work with them, and that's how they are building in this right up to the district and sub-district level, which is something very heartening. So this part is, as far as we are concerned as a country, we have already in line with Glasgow. We are already putting it in place prior to Glasgow, so to say. The second aspect, I think, this is the part which really needs more encouragement. And that, is the aspect, I'll end on this point, that, physicians are also, they have the reach to their patients. And some physicians, there are some bad apples or whatever everywhere. But by and large, people respect physicians. And I think we have earned a lot of respect as a community during COVID. whatever we did, and so many even died, unfortunately. But the point is that people regard physicians. So when you see you have physicians, who basically, show the way. I mean, if they may not actually even really, for example, your physician, he drives in with an electric vehicle. That itself is a statement. He doesn't need to, he or she, I'll be very gender sensitive here. So he or she need not, actually tell you, you need to buy an electric vehicle. But at the end of the day, I know it that a lot of people regard their physicians, and then if they see their physicians, changing, being front runners and being green champions, that really makes a difference. And we have some doctors, and I don't want to name particular doctors, but there are, you've seen that there are doctors who are out there who are championing the whole cause of air quality, climate change, and I think that is another very important dimension, because what that does is for society. Hospital as a compliance issue, or since other hospitals are doing so, we should also do. That is one aspect of it. But the other aspect that, here is a
I think we lost his voice, probably some internet problem or screen is hanged. So taking back to Swayam Prabha, in the meantime, if he comes back, probably he was moving out for another meeting. Swayam Prabha, I think one more last question. Do you think that anything else would have been done, or kind of a policy addition, international policy addition to the Glasgow Pact?
Okay, so just to conclude, so what I was saying is that the second aspect, doctors as change agents, as people. Yeah. So the point I was making, Dr. Shalini Sharma, was that doctors as change agents can really make a difference besides the sector as a whole in terms of climate-friendly hospitals and health facilities. Thank you so much.
Thank you so much for your time today. I know you have to run out, and I just posed one small question with Swayam Prabha, and with that we will be wrapping out in another 5 to 7 minutes for sure. So, sure. Yeah, over to Swayam Prabha.
Okay. I think I'm not very disappointed with this COP actually, because we are in a post-pandemic situation, and a lot needs to be revised, reworked, rethought. And I'm actually very hopeful that the Sharm el-Sheikh work plan is going to be more proactive. It's going to have more of the issues that we could not discuss at this COP come up through that work plan, and the next COP is going to address them heads on. But what I kind of got back from this, whatever I followed virtually, is that there is an interest and enthusiasm, and people have started, governments have started understanding that we have no choice. So it's time to act. But how fast and how far and how much we put in is up to us as a country. And while I do appreciate the difference between developing and developed nations, but when the crisis hits, it doesn't know these boundaries. So we cannot say that we are a developing nations and we will not reduce our emissions, or we will just focus on adaptation, not on mitigation. We don't have a choice, right? So even what has happened, the historic past, we all know of it. Appreciate that countries need to grow, need to build. But this is the time when we put in those right systems, the right technologies in place. We have no choice. So instead of sitting back and saying and going back to our historic perspective, we should start planning for the future and plan it well. and also help other countries plan it well, because we are all going to go down together. Like the pandemic took us all together, it got us all. So there were no boundaries. So here there's no boundary. And let's be mindful of that. And let's not pass on the responsibilities to the next generation, because we don't know. Thank you.
Thank you, Swayamprabha. Thank you so much. I think you are 200% right. We should say everybody's sailing on the same boat, and land is limited, resources are limited, and ocean is not limited for sure. So that need to be taken care. And thank you, Dr. Nitish Dogra, for making your time for us today. Thank you, Swayamprabha, for being with us today.
So I'll just end with one last phrase.
Yeah.
I think we should all wish for a healthy climate and also a climate for health.
And a healthy ocean.
Okay, we give that too.
And I will add as healthy air also, because that is what we keep us.
So a healthy environment, a healthy planet, and a healthy people.
Absolutely. Thank you so much. Bye-bye.
Bye.
Rakund, I hand over to you for proposing vote of thanks and then closing.
Sure. On behalf of the Global Institute for Circular Economy and Sustainable Development Goals, I'd like to thank our guest speakers, Dr. Swayamprabha Das and Dr. Nitin Dogra, for your valuable time and the extremely thought-provoking discussions that happened. Thank you for showing us the reality of what there is and what needs to be done. And honestly, I could not say it better than everyone just said it with all the phrases. So with that, I'd like to thank you once again. And I'd like to close the web event, Glasgow Climate Pact, What Could Have Been Better, on 3rd December 2021. Thank you and have a good evening, everyone.
Thank you.